things, but I recognise it's also one of the factors when it comes to school funding that we need to take into account looking forward.
Miriam, sorry.
Thank you. So moving on to testing, lateral flow testing. So the department's view has always been that lateral flow tests were introduced to keep kids in school. But I think common sense would now say that it's lateral flow tests that's keeping children out of school, because in testing asymptomatic children, so children who are well, finding that they are positive for COVID and then forcing them to take time off school, we're actually keeping tens of thousands of children out of school who would otherwise be in school if we weren't testing asymptomatic children. Now, we were promised a review at the end of September of lateral flow testing. The Royal College of Paediatrics have come out and said we should stop it, it's causing needless disruption. And there have been several moves over the weekend for the JCVI and others to move back to preventing serious disease and not transmission. So when are we going to have a review of the lateral flow testing policy? And what's the evidence that it's keeping children in school rather than actually driving up absence?
Well, I think the crucial missing element, if I may, in what you were saying there is that, yes, of course, if someone has a positive lateral flow test, if they're asymptomatic, that could potentially take them out of school. But if it resulted in them not spreading the virus to many more pupils, it could also keep many of their fellow pupils in school. So I think the point about where we are with testing now is that we have moved from a situation in which previously, earlier in the pandemic, clearly there were bubbles where one person in a class tested positive, there would then be a whole load of people who would be taken out. We've moved away from that. We've moved away from a situation in which people would take a lateral flow test and then have to take a follow-up PCR test and then wait for the requisite period of time. We've reduced the time that people can return into. So it is just the case of whether or not they are carrying the virus, and then after they've taken daily lateral flow tests over a period of time, they can return to school. So we've reduced the amount of time that individual children have to stay out of school for being COVID positive. I think all of those things taken together will actually mean that more children can be in school and fewer will be out of it. The challenge that we have right now is we do have a very high prevalence and a high level of contagion from the Omicron virus, and that is why I think it makes sense to try and take preventative measures using lateral flow tests to keep children who might otherwise be transmitting to to more of their classmates away from the classroom for a shorter period of time as is reasonably possible. And you'll have seen all the debates about 7 days versus 5 days, etc., etc. I think if the scientific advice shows that 5 days is safe, I would welcome a move in that direction. But I think it is something that we need to constantly look at what we can do to minimise the disruption from the virus. And to your point about, do we want to try and pick up people who are asymptomatic? The vast majority of children probably will be asymptomatic if they're carrying the virus. But therefore, yes, we do, because we want to avoid that becoming every child in the class, which would then cause greater disruption.
Isn't there a problem there, Minister, that unfortunately one of the things that we don't know and can't be sure about is what is the parents' vaccination status? So if children are passing the virus to one another, they're going home to a situation where we don't know the parents' vaccination status. And of course we do know that the parents of particularly primary school children are in the age groups where the vaccination rates aren't as high as we would like them to be.
No, I think that's a very fair point, and that's also one of the reasons why we continue to recommend that all adults do get boosted, get their jabs, and continue to move forward on that basis. I think the evidence is constantly strengthening about the protection that vaccination, in particular boosters, give you from serious illness, and that's something that we hope parents will take into account wherever possible. Of course, we also recognise that there are going to be different parents with different situations with regard to their vulnerability. And so that is something we also have to bear in mind when looking at schools. But I think from that perspective, keeping transmission of the virus down is important. It is the basis, the fundamental basis on which the decision to have masks for this period has been taken. And in that respect, I think having very regularly available lateral flow tests has been a very useful part of how we can contest that. I mean, we've all seen, and I suspect all of us will have heard from constituents over the Christmas period with some of the challenges of getting a PCR test quickly and effectively. And although there were some delivery challenges with lateral flow tests themselves, I think they have remained much more regularly and freely available, and that's also part of the equation.
Just to push back on that, though, on the point of reducing transmission, Omicron is highly transmissible. whilst vaccines still absolutely protect against severe disease, the evidence has shown that, they're not stopping people transmitting Omicron to each other. CMO said we're all likely to catch it. If most children are not asymptomatic, and I'll be interested in the data of this, what is the point of preventing transmission? If we compare this to a standard childhood illness, a cold, a cough, a sickness bug, what we ask the child or the parents to do is keep the child off while they have symptoms to reduce the likelihood of spreading, and then they come back when they're well enough to learn. If we move to that model for COVID, for Omicron, where a child, if they're sick, they stay at home, and when they're well, they come back to school, my guess would be that we would save an enormous amount of unnecessary absence and children continuing to receive disruption, potentially missing important lessons. So we will promise this review at the end of September. I really would like to know when we're going to get that review, and I'd also be interested to know how much it's costing to perform all these lateral flow tests to the DfE.
Well, I think obviously we did put a investment into providing lateral flow tests for the testing on return programme for schools, but the majority of the lateral flow testing that has taken place, and I think we've had 96 million tests registered over the course of the last year in lateral flow testing from schools. The majority of that is, of course, through the public health route, so it's not a budget, but we are responsible for in that respect. We did provide 31 million tests to schools for the beginning of term, and I'm told also we did actually provide some face masks to schools at that point to help with these issues, but that's not designed to be a universal offer in that respect. And of course, this is just secondary schools we're talking about in terms of the testing programme. I think I've pointed out already some of the policy changes which have already taken place on testing, and I think some of those have moved in a helpful direction as far as we're concerned, because they are allowing more children to stay in schools. I think really the question about a review of lateral flow testing overall is one for health colleagues, and it's one I will certainly take away and discuss with them.
Thank you.
Thank you.